Good afternoon, everyone, and welcome to this presentation, An Introduction to Becoming Carer Aware, as we celebrate National Carers Week. I'm joined by my colleague, Tanya Daniels, and in the next 30 minutes, we will cover some key information designed to strengthen your understanding of carers and their contributions. We will also explore information, supports, and resources available to carers. We start by acknowledging the traditional custodians of the unceded land on which we work, learn and live, the Wurundjeri, Woiwurrung, Bunurong and Wathaurong peoples. We recognise the unique place held by Aboriginal and Torres Strait Islander peoples as the original owners and custodians of the lands and waterways across the Australian continent. We also acknowledge their enduring cultural practices of caring for country and pay our respect to elders past, present and emerging. There are over 750,000 unpaid carers, family and friends in Victoria. A better understanding of carers and the challenges they face is key to caring for our carers. As practitioners, you play a pivotal role in caring for carers. We acknowledge you know and understand carers in your community best. However, at Carers Victoria, we also hear from a broad range of carers and practitioners, and we wish to share some practical ways that you might consider applying the information that we are presenting today.
We'd like to invite you to, first we'll start with a definition. Carers Victoria refers to a carer as a person who provides unpaid care and support to family members of choice or origin, friends and or others with a disability, mental illness, substance misuse, chronic health issue, including palliative care or age-related care needs. Understanding the definition of an unpaid carer is key to assisting carers. It separates unpaid carers from professional support workers and practitioners. It also ensures accurate recognition, enabling us to assist carers to access supports and services. Carers usually fall into one or more of these categories on your screen, that is, primary carer and secondary carer. Typically, you'll meet primary carers in your worker role, and they are the key person who support the person receiving care. Carers can also be a primary care for one person and be a secondary carer for a different person. An example of this is someone who is caring for their child who has a disability, but who is also supporting an older parent who has care needs. This is an important concept to be aware of, especially when it comes to pointing all carers to services and supports. Carer empowering language is essential because it ensures that unpaid carers are recognised, respected and supported across all areas of society. When service providers consider language, carers are more likely to engage with them. On screen are some key principles. You'll notice that we've advised you not to use the term loved one, even though it is commonly used. We discourage the use of this term as it implies a number of things that may not characterise the caring relationship. Organisations can adopt carer empowering language by reviewing and updating policies, forms and communications, by upskilling staff, and by using carer inclusive language.
Thank you, Tanya. We'd like to introduce you to some statistics to tell the story of Victorian carers. Carers vary in age. They can be as young as 5 and as old as 90. The majority of carers are aged between 45 and 64 years of age, and over a quarter are aged 65 and over. Many of this cohort have their own medical issues, which they may not prioritise because of their caring responsibilities. It is important for practitioners to keep this in mind so they can ask carers about how they are looking after themselves. The equal top 3 people carers are caring for are their partners, their children, and/or their parents. You'll also notice that women account for over 2/3 of primary carers. There are many more statistics about carers which you can find on the Carers Victoria website. Many carers are hidden in our society and communities, and that's also represented or underrepresented in data. So why are carers invisible? There are many reasons. They may not realise themselves that they are a carer. They may see the support that they provide as an extension of their familial role as a parent or an adult child, for example. In some cultures, there isn't even an equivalent word for carer. The work is viewed as an obligation or part of their role. The support that they are providing may not be acknowledged by their own family and/or practitioners. You can assist carers to self-identify by explaining that they are a carer because they go above and beyond what the average person would do in their role. This point of difference is what makes them a carer. Carers provide a wide range of support. Being aware of the varied support carers offer to the person receiving the care is pivotal to truly understanding the carer experience. Carers perform visible and invisible tasks. These are not always easily seen or acknowledged. Sitting beneath the iceberg, these invisible tasks, such as systems and service navigation, can take enormous amounts of time, mental energy, and perseverance. And we also know that carers contribute enormously to the economy through the unpaid work that they perform. The cost of replacing unpaid carers in Victoria is estimated at over $18 billion every year. That is just in Victoria alone. At the time this calculation was done, this was more than the Victorian government was spending on healthcare. Many carers, particularly primary carers, those ones that are providing the most intensive and regular care, are often forced to reduce their working hours, take on less demanding roles, or withdraw entirely from the workforce to meet their caring responsibilities. So caring comes at a significant financial cost to the carer. With these lower workforce participation rates, on average, by age 67, a primary carer will have lost $175,000 in superannuation, equating to $392,000 across a lifetime. The most affected 10% of primary carers by age 67 will have lost an average $444,500 in superannuation and a total of $940,000 in lifetime earnings. In addition to the economic cost, caring also comes at an emotional cost, as is shown by the information on the screen. Even though as a practitioner, you may not be able to change the situation for a carer, the simple act of listening with empathy can be very supportive.
Thanks, Angela. Despite the challenges that come with caregiving, it is encouraging to know that carers have access to a wide range of services and support in the state. And we'll unpack these supports using this three-tiered model on the screen. So we'll go through local supports, Victorian supports, and national supports. We'll start at the centre of the model with Carers Victoria. Carers Victoria exists to advance understanding of Victoria's unpaid carers and improve their access to assistance across the state, regardless of who they are, where they live, or who they care for. We provide a range of assistance to carers, including government-funded respite and support, education and training, events and other activities, and ongoing information and advice tailored to carers' needs and interests via the Carers Victoria Advisory Line, which is 1800 514 845. It's open Monday to Friday, 9 to 5 p.m. If you'd like more information, please visit our website. On to carer support groups. Across Victoria, there are many local carer support groups which Carers Victoria communicates with, actively promotes, and networks. The Carers Victoria website contains a register of carer support groups across the state based on geographic area and condition of the person receiving care. As a practitioner, this is a useful tool to explore the groups available for carers in your community. Carers Victoria also offers free membership to carers, former carers, supporters, and carer support groups that include a range of benefits. Please use this QR code to join or visit our website. Continuing with the Victorian supports, there are three main benefits available for Victorian carers, as you can see on your screen. We'll start with the Victorian Carer Card. This is administered by the Vic government and it provides a range of discounts for retails, leisure, activities. Carers need a Centrelink client number, or a letter of support from their GP to apply for this card. Then there's the Victorian Companion Card. This is actually owned by the person being cared for rather than the carer. It enables a carer to access events and activities for free if the person they're caring for cannot attend independently. There is also the Carer Myki card. This provides half-price travel for carers and can be applied for via the PTV website. There is also Victorian government funding across two specific programs to support carers. These include the Support for Carers program and additional respite. Funding is flexible and carers are encouraged to ask for what they need. Some examples of support include, but are not limited to, carer respite, practical in-home support, health and wellbeing initiatives, equipment and aids, transport, peer support, counselling, and advice and information. And at the local level, many councils and neighbourhood houses are carer aware and may have engaged with Carers Victoria Education to better understand carers. It's worth investigating what your local council and neighbourhood house is offering carers in your local community. On a national level, the Carer Gateway provides emotional and practical services for carers, including emergency respite. As a first step, you can support a carer by referring them to the Carer Gateway. Carer Gateway will also refer the carer to local services. And before closing this section on supports and services, we invite you to stay connected with Carers Victoria through our website and subscriptions. The number of carers in Victoria is steadily growing. We know the caring role is an intense one, and carers need support to last the distance. If we look at that quote, it says, if we don't look after carers now, Australia will need to address an increasing carer deficit in the future as our population changes. Hence the importance of caring for carers. This National Carers Week, please show your support for carers and spread awareness by using resources on our website and taking some simple actions to uplift those who care for others every day. Thank you for your interest and making the time to attend this webinar. And we will post out some session materials after today. Thank you, Angela. Any closing remarks?
No, thank you everyone for attending. And as Tanya said, there will be a range of post session materials, including a discussion guide that you might like to use in your teams and with your colleagues. We'll also invite you to a very short survey to assist us to improve moving forward. Thanks again, everyone. Happy National Carers Week. We appreciate all the wonderful work that you are doing.
Thank you.